So now we have a little session, more like a discussion, about how was it for you, the patient's experience of accessing NHS services during these COVID times. And that will be between myself, Brian and Dani. So we look forward to hearing what we'll be doing, and I'll pass you over to Brian.
Yeah, okay, thanks. Well, we haven't rehearsed this at all, so just stick with us. I'll tell you a little bit about what happened to me. In the middle of March, I suffered what I thought was a really bad asthma attack a couple of times, and was put on steroids by the GP. However, being a bit slow in the uptake, I got worse and worse, and phoned the GP to say my cough, which was pretty relentless, was getting worse whenever I'd stopped taking the steroids. Clever GP asked what else was going on with me, because he didn't think it sounded like an asthma attack. And I was able to tell him about the back pain, the night sweats, the general feeling of incredible fatigue and other things. And yeah, so then he put two and two together and said, it does sound like you have COVID. You need to behave as though you do have COVID. And that's what happened. My wife and I both became quite ill. And we both are still struggling actually from what they're calling long COVID now, and still finding it a little bit of a struggle with the fatigue and so on. So yeah, it's been a bit of a difficulty. In terms of accessing healthcare and so on, I found the GPs to be really helpful, and it is difficult. I find not having been tested a bit of a challenge at the time, because you're always struggling with the possibility you don't have this. It's something else. But I have behaved as though I have COVID, and I think that we certainly up here, it's been challenging because I live in a very rural area. And one time I did get extreme pain in what I imagined was my kidney, and was told to go into a COVID assessment unit one time, and there wasn't any problem with my kidney. I think I'd torn my intercostal muscles from all the coughing, and I thought that was really interesting, into this very highly sterile, controlled environment. But I did think that I wonder whether or not assessment centres are really required, and whether or not it is something that could be done in a more kind of routine primary care way. But what do you think, Rachel?
Yeah, I agree. I just listened to what you were saying, and how did it feel like knowing that you had COVID and you didn't get tested?
Yeah, I think that's been one of the biggest challenges, actually, Rachel. They weren't testing at the time. I mean, ultimately, it doesn't really matter, because it doesn't change your behaviour all that much. But any little ache or pain that you do get, you kind of tend to think that this might be COVID. One of the problems I have is I'm profoundly deaf. And one of the things that's happened to me over the last few months is I've developed this particular type of tinnitus called pulsatile tinnitus, and my ENT consultant is of the view that it's a nerve that's probably been damaged by the COVID virus next to my cochlea. So these are things that, again, if I'd had a definitive diagnosis, it might help me. It certainly would help me psychologically, I think, to come to terms with it, because there's always that question as to whether it is or it isn't COVID.
That's true. Brian, is it right that you have a stoma?
Yes, I have a stoma, and in fact, that was one of the things that was a challenge to me at the start, because one of the issues that a lot of people who have stomas are concerned about is developing a parastomal hernia, which is a bulging underneath the stoma itself. And these are pretty awful, or they can be pretty awful things. I have one myself. And I began to think that it would be worthwhile having some sort of information out there for people with stomas, ileostomies, colostomies, and so on, to look at what the risks might be. So I contacted Terry Porritt, who is connected to Fab Academy, and she also works for Coloplast, and we put together a podcast, and I wrote a little article which got quite a lot of interest and stimulation from the wider community of people with colostomies.
Brilliant. Yeah, and I've read that document, and it's really interesting because I think people worry that having COVID with a stoma, with all the coughing, that is going to cause a hernia and is going to cause some issues. So it was good to read from somebody that actually had COVID and how you went about that. Have you found accessing GP services, Brian, during this period?
Yeah, it's been okay actually. The GPs have been very receptive every time I've phoned them, which isn't that often. They've seen me whenever I needed to be seen, or they've been able to treat me over the phone. One of the things that I want to ask you about this as well, Rachel, because you were in hospital during COVID and in patients. But one of the things that happened to me was I stupidly lifted a pail of water from one side of a sink to another side of a sink and got an extremely bad pain in the parastomal hernia area, and I was contacted by my surgeon, my colorectal surgeon, who conducted a video consultation with me 2 or 3 days later, and was able to explain exactly what happened. Basically, it would heal itself, and I think that was one of the things that I've learned. I personally have learned to value is the use of IT in some of these circumstances as well. But yeah, the other thing I want to just pick up on is the effect on mental health. I think that a charity that I chair is called Black Isle Cares, which is looking at how do we support older people in a rural area who are suffering from social isolation. And that is a challenge for everybody. But I think certainly in terms of the COVID experience, I found myself getting quite obsessed really by the information that was coming out. And I remember this was around about March, April. I was fixating on Governor Cuomo in New York and listening to his updates every day. In fact, I don't know if you can hear them, but we keep chickens here, and one of our chickens hatched, and she was called Cuomo. And I tweeted that, and somebody suggested it might not be a great idea to call a politician after a chicken, but for me it was supposed to be an honor. So yeah, the mental health aspect of it, we're all looking for. We've just had that amazing presentation from Milton Keynes, and the loneliness and isolation that people have felt through the COVID experience, I think, is very profound. I find that social media helps tremendously. And I want to ask you now, Rachel, you're a prolific tweeter and you're a prolific user of social media. How was it for you going into hospital during this period?
Well, it was very difficult. I'm used to going into hospital quite a lot. I suffer with urosepsis, so my bladder and bowel have been removed, and I get urosepsis quite often. So I'm used to hospital admissions. So just before lockdown occurred, I think in February, I had an admission, and it was a week before they announced the lockdown. And I was on my usual ward, the urology ward, and the staff were petrified. They were really worried. They were clearing out the beds. The ward was going to turn a COVID ward. You could just see how sort of scared the staff were, and they were still being brilliant with patients, but they were concerned and worried. So I went back home, and then I got admitted again a month later. So this time I got admitted onto a COVID surgical ward. I was on that ward even though I was COVID negative, and it was very, very difficult. I found I'm used to being in and having a laugh and a joke with the staff. There was a lot more seriousness. Because I was on the ward, they were in full PPE. I found it quite difficult hearing the staff, even though my hearing was fine, but I found it quite difficult. I'm septic, I'm very poorly, my temperature's high, and I couldn't really understand. I was very scared. I felt more scared than I had before. I think because just the layout, you know, the fact that I was on this ward, there weren't many COVID patients on the ward, but the staff coming in weren't the ward I was on. So yeah, it was quite tricky, and for me, it was not having visitors. I never realised the impact of not having visitors. I thought that I'm fine, I'm independent, I'm used to being in hospital, but mentally, I really struggled, and I struggled because I needed that with my family. Yes, I had video call, and I was really lucky that I could do that. And then I started thinking about patients that didn't have that able to do that. But to hear that what Milton Keynes have done is just fantastic, because it shows that they are thinking about what it is like for patients that aren't able to do video call, that don't have the means to do that. But after that admission, I was in another 2 times. So during the whole lockdown, I've been in 4 times. And each time was slightly different. So as the summer was getting really hot, in the trust that I went into, they weren't allowed any fans. So no fans were needed. Yeah, and it was when it was about 30 degrees. And that was really difficult. I had a temperature of 40, 41.
I was going to say you'd be baking anyway. You'd be roasting.
Yeah, and I couldn't have the fan on to cool me down. So they just covered me in compress, like cold tissues, to cool me down. But when the temperature had gone, and it was the week of the admission, and it was really hot, patients were struggling. But what the staff did, which was really good, is they went and got bowls for us, and they put bowls of cold water and tissues. And sometimes the small things really are the big things. Like that meant the world. I tweeted about it. That meant the world, because they thought about what it was like for us being in there, you know, and not allowed to have visitors. But what I felt that we did on our bay was we really helped each other. The patients, we supported each other because we didn't have those visits.
How did you do that? What sort of examples?
Well, just chatting to some of the patients. I was more mobile than some of them, so if they wanted something, I would get them, or if they wanted the nurse. But I felt that we kind of talked to each other, and that helped mentally, because we weren't able to see our family or loved ones. I know one patient in particular, they wanted to speak to their family, and the nurse was very busy, so I got my phone and I put the number in, and they spoke on my phone. You know, and they were really grateful for that. And I felt that we just kind of came together, and while you've got all that time, and supported each other. But also during the summer, what I liked was the staff were given lollies. Now I know that sounds really funny, but the staff were given lollies to try and cool them down, because all I kept thinking was that this mask I had to wear, I really struggled to wear it. I didn't have to wear it all the time, but when I first went in. And the staff were wearing them all the time, and I kept thinking that it must be really difficult, especially in the heat. And I really felt for them.
I mean, how did you cope with that sense of isolation and loneliness? What was that like for you? That must have been terrible, really.
I was surprised how hard I found it. You know, I'm very independent. I live on my own. I'm used to being in hospital, and I thought I would cope no problem. And I was surprised how it hit me really hard. Not having the visitors, the difference in what I'm used to. There wasn't as much laughter, and understandably so, because they're so busy and so stressed, and so much was happening that you could really feel that as a patient, and it did feel quite lonely. It felt quite difficult. And my last admission, it was we're allowed visitors, so that was a little bit better. And I was just really grateful of having visitors. I never realized the impact that has on a patient. You know, you're scared, you're petrified, you're very poorly, and not having your family, actually how much the whole day feels longer. And I also found that I noticed that in not having visitors, the staff seemed to be busier, and they actually openly talked to me about how visitors helped them have a little bit of time to do things. They were actually more busy and not having visitors, because the visitors would do things, bring things in, and the staff were taking that place.
You and I had a chat a few days ago, and I mean, you are an expert patient, really, aren't you? You're in and out of hospital a lot. You know your condition inside out. That must be very, very difficult. But if you don't know what's happening to you, and you're not an expert in your own condition, and it's just something that's happened, it just must be extremely scary.
Yeah, and I think the other thing that was a factor was, I was put into shielding, and then I had to go into the hospital 4 times, and I was thinking, what if I got coronavirus? I'm on the hospital, will I get coronavirus? So not only have you got the fear of what you're actually going through and what your illness is, you've also got the added fear of, am I going to catch coronavirus? So it's kind of this, it's double. You could really feel the energy is doubly worrying than it would be kind of normally. Somebody just put, that's an interesting point. It sounds really silly, but I've never considered the concept of patient-to-patient support. Yeah, and quite a few times during all my admissions, if I'm able to, something really simple, that there was a patient with dementia who really struggled at night. And what I did is they loved music. So I went and put the hospital radio on for them. And the night before, they were quite difficult the whole night, and it really calmed them down. And it was really simple. I just went over and put the radio station on. But staff don't always have time to do that. But sometimes patients will help patients. And I've noticed some other bays, when I walked past some other bays, they were also really talkative. And it seemed to be that where there was a gap in the support for us, we turned to each other, which wasn't too bad. Sometimes it might be if there's patients that are struggling a bit difficult, but it seemed to work in my case.
Yeah.
Rachel, so did they put anything in place with regards to shielding within the hospital? Because you're saying you were put on a COVID ward, and you were technically meant to be shielded. Did they put anything to reassure you whilst you were on the ward?
Yeah, so I was in the surgical COVID ward. They put me. I was on that ward, and then my COVID test came back as negative, but they wanted to keep me on there. I was kind of okay with it, really, because I was in this massive room and I was in a side room, and I wasn't too worried about it. But my family didn't understand why I was kept on there. I think there was some issues that were happening with moving patients around, and the consultant kept me there. In the end, I was okay with that. But it was a fear at the start. I know that my family struggled with that I was in shielding, and then I had to be on this ward. But I don't think there were many cases on the ward. I don't know if it was 0 or none, but I don't think there was any positive cases possibly.
Did you find that social media helped you? You were saying you were tweeting out about things, and I remember reading some of your tweets at the time, and it did sound really quite scary, really, what you went through. Do you think that there is a bigger role for social media in supporting patients?
Yeah, definitely. There's such a huge role, and not just social media, but the different platforms within that. So Facebook, there's support groups, and I would message in there, mainly asking around my urosepsis. Is there something that other people have done, and that I could maybe ask the doctors about to try and stop having it? And Twitter was also very helpful. They're sharing some of the good things that I could see in the hospital, because there were the staff were incredible. They were trying to put on smiles, even though you can't see it through the mask, and they were really trying to put patients at rest. And I could see some of the good things as well. So Twitter does have a place, and social media definitely has a place for support.
I find it even difficult to get a signal in our hospital, never mind use Twitter too.
Yeah. Dani, how was it like being in shielding? Because you're a healthcare professional, aren't you? And you were in shielding.
Yeah, so I'm a district nurse by background, and I worked the first couple of months, I think, really, during the beginnings of the COVID, and I was advised by my GP to go off, and I think my pride and stubbornness got in the way of that, and I was very much, no, I'm not. My patients need me, my staff need me, because at the time I was doing a secondment for a senior band 5 role, so I was kind of doing a band 6 role, so I was supporting a lot of other staff as well. And I think it's hard because for me, I was very much, no, they need me more, and what's the worst that could happen? Because I think it was very much unknown at the beginning, and I even made a few jokes of, you know, I was an ITU nurse, I could at least work my own ventilator. Didn't go down too well, but you know, that was my way of dealing with it, I suppose, was the humour. And then as it got progressively worse, my anxiety started to increase, because I've always suffered with mental health. And after being severely poorly last year, and 5 hospital admissions, my anxiety and depression had kind of got worse anyway. And then this just kind of heightened that. So I was in a new team with new people, not my usual crowd, in an unknown kind of environment of what was going to happen. And then we were getting told a lot of things about the community and what we were going to have to do, and that the majority of people were going to have to be cared for at home. So we knew that we were going to get quite a lot of cases that we were going to actively have to go and see. And eventually the GP kind of took it out of my hands and said, no, it is time now. You need to take the time off. You need to go home. You need to look after yourself, because the trust could replace you tomorrow, but your family couldn't. And that was a real eye opener for me at that point, with, you know, all the jokes aside of ventilators and ITU, you know, with my conditions and the things and my health, that actually, yeah, I could die from this virus, and maybe it was time to go home. And I didn't get a formal letter from the government to shield. It was a GP, a sick note, so I couldn't even work from home, because it was technically, I was off sick. The trust couldn't provide anything for me to say that, you know, you can work from home, because technically I was off sick. So I think that made it even harder, that I couldn't even help in any way. I was watching how busy it was getting, how hard it was getting for people, the mental health of my colleagues, and the way they were having to work through it. And that got really hard, and I think my mental health really suffered. As it stands, I'm a manager of Pandas, a perinatal mental health charity, and I really got stuck into that, and understanding that actually parents who are giving birth for the first time or the second time, or, you know, third or fourth time during the COVID, with there's such a change in how the NHS is working for them and their support, that I really started to work on that, and that kind of helped me through it a little bit more, because I was able to help people more, knowing that virtual support was there, and that I was looking after my group leaders so that they could run their virtual support and ensure parents. So I kind of got through it with that respect, but the guilt never left, that I felt like I'd abandoned my colleagues. And it takes time now even to say that I was off for such a long period of time, that I did feel like I abandoned my colleagues and kind of threw them into the fire without any help. So yeah, it's tough.
Yeah, I remember the feeling. Both of you have reminded me of this when I was first started off on this, and the horrible cough, and thinking, actually, I feel I might die from this, you know, and that feeling of your sort of mortal state, it kind of brings you up hard and fast to the reality of it, doesn't it? That's, you were saying that you had similar, Dani, when you were sort of, that was a turning point for you.
Yeah, it was. And I think it's hard, isn't it? Because you can take, especially any kind of professional, you take yourself out of your human body, I suppose, sometimes, and you put yourself as just a professional and just a nurse, and that's who I am. And it was very hard to come home to my three children and my husband, and feeling like actually one day I might not walk through that door, and how that would impact on them. And that was my turning point of saying, do you know what, actually, my family is important and my life's important. And as much as people put their lives on the line for lots of different jobs and professions within with all over the UK, I wasn't willing to do that at that time.
Are there any questions coming in, Rachel? Any other points?
Yeah, there was question saying, Rachel, are you still shielding, or have you successfully reintegrated as far as you can? Yes, I am reintegrating. I'm still being very careful, socially distant, not hugging people. But I came out of hospital about 4 weeks ago, and it looks like it's a month and a half thing for me. So the chances are I will be back in. So I'm trying to stay as safe as I can, but I want to be out. I don't want to be stuck in all the time. And my doctors have said that as long as I'm careful with socially distance, you know, in his words, was enjoy what you have, because you'll be back in, but be careful. So that's what I'm doing, really. I suppose for me, my biggest fear is because the sepsis keeps coming back. So that's kind of, although I'm worried about coronavirus, that is I'm dealing with the sepsis thing all the time. So that's in my kind of forefront. But I am being careful and taking advice on that way. My parents live in Wales, so now they're locked down. I don't think I'll be seeing them for a while. There's a few other things that come in. So it was incredibly frustrating that as GPs we were not allowed to test our patients for COVID. Even in A&E, we were not allowed to order a test unless that patient was admitted. Very difficult for patients to come to terms, manage a diagnosis without the proof on the test.
Yeah, I can imagine. That's from Nina, I think. Yeah, that would be a very, very difficult thing. I mean, I think that's what sometimes I think as patients we forget that, you know, the health professionals are very, very frustrated by all aspects of this as well, I think.
And John Beatty's put, in Glasgow, we had iPads given to all wards and volunteers to go around and make video calls for patients on the iPads. I believe there was a booking system for families to be given an appropriate time for calls. Is this something that was adopted anywhere else? We heard about that similar to Milton Keynes just shared about that. I know that my gran at the moment is in a hospital in Wales, and they haven't allowed visiting throughout. Even when the measures got lifted a little bit during the summer, they were still not allowed visitors. And my gran is 95, and I know that they had the iPads would be given her to video call my dad and my auntie. But that has been quite difficult in itself for my family, because my gran has had no onset dementia before, and now because not seeing us, the family, she now has got onset of dementia and is getting confused. And she used to be a nurse herself, and I know she keeps telling all the nurses how, you know, she knows what to do and all that things, but she struggled with not being able to speak to us. And my family, I think, have struggled with that as well. But the liaison, the family liaison officer, has helped them a little bit. But I know that even with that help, it's still not the same as seeing somebody in person, because my gran can't always hear the iPads, can't always understand. She can get confused. She thinks that they're in the room. And that's quite distressing for my family, who we haven't experienced anybody with dementia in our family yet, you know, which we're very lucky. So I know that my dad and Auntie Rose are struggling with that. Phil Hammond said, we can't let it regress to how it was. 80% of consults can be done not physically together. All the algorithms on AI lead primary care programs suggest so.
Dani, what do you think is the biggest lesson for staff members in who are feeling ill or are at risk, from your own experience?
I think it's just go with advice, and you know, the world carries on. The jobs are going to be covered. People are cared for. Nobody's going to let anything happen to anyone just because you've got one or two members of staff down, and you know, and really look after yourself, because you know, one of the things that the GP actually said to me, and I think this is one of the best advice I was given, because it really helped my mental health, was when everybody else is exhausted throughout the whole of everything that's gone out, you'll be fresh to go back and help them and support them when actually they need it the most. Because we are about to fight something new again, and things are rising, especially up in the northwest where I am, where we're seeing a significant increase, and we are in tier 3. That actually they're already exhausted, but I've had that time away now that I can go back and I can help support them, because I'm not exhausted, and I think that really helped for that, and I think that's a great bit of advice.
Yeah, are you back now then, or are you going back, or where are you?
I'm back. I'm back. I've been back since the first week of September, and we did a full risk assessment of what I could and couldn't do. So at the moment, I can do pretty much all my jobs, apart from I wouldn't go into a suspected or a positive COVID patient. I would stay away from them, and I would go to the low risk and more shielding patients, and I do a lot more shielding within the office, so I tend to wear my mask. I know it's just coming now that we wear a mask all the time, but I would do that anyway prior to that, and I look after myself within the office and moving around.
Dani, have you found that social media has helped you? Because I followed during the kind of lockdown, I followed some of the things you put on social media, and I found your honesty was just really breathtaking, and how many it helped other people. Did you find it helped you?
I did, yeah. I found it as an outlet, because as much as my husband was here to help support me, he has an opinion sometimes, and it wasn't easy for me to get out how I felt and what I wanted to do. And I did really hit an all-time low, and actually from the experience, I'm actually leaving nursing, and it's made me reorganize life and where I want to be. And it was good, because I could see what else was going on. I knew I could help other people, and actually watching a lot of the things that were going on would help me process things and see that what was actually going on, and it wasn't just my world falling apart, that actually there was a lot of people. And I think once all this has settled down and things are of a more normal, I think mental health is going to be a massive thing we're going to have to look after. And I do think that social media, with, like you said, some of the groups that are available, the support and the watching and the things that I was able to get involved in, really helped me. And it was quite cathartic that I was able to help other people just by being honest about how I was feeling. And I'm really looking forward to the next chapter, because, like I said, it made me refocus life, and I am leaving nursing for a while.
Well, Kaz has just put a message saying, shame that you want to leave nursing.
Yeah, it's been a long, I love nursing. I'm a massive advocate for nursing, and I'm not leaving nursing because I don't like nursing or anything like that. I think I've just not found my niche within nursing of where I want to be. And my huge passion is perinatal mental health. And when I've been feeling as bad as I have this year, and the fact that I had to shield and go off as well, made me realise that I'm not nursing to the best of my ability. And I don't want to feel like I'm trying to nurse when I feel that I'm not doing it well. And I know that's a lot of pressure on myself, and I know that's my own mind, but I do find that really difficult to understand that if I'm going to nurse, I want to do it, and I want to do it really, really well. And with perinatal mental health, I am the manager of Pandas, the charity, and I've done a lot of things with them. I've introduced a lot of training and support, and done a lot of new things with that. And then now I've got a job in the local maternity services, working with patients and actually changing services with their voices. So I'm actually actively advocating what I believe in, which is the patients know best. The patients know how the services should be run, and now I'm able to use their voices to change those services. And then hopefully I'm looking at doing my master's in April next year to become a mental health nurse and get into that. So I'm not leaving nursing forever. It's just a little bit of a sidestep for the moment.
Dani, that's fantastic, and that's fantastic that you found what's important to you and go in that way. And it sounds like COVID has given you that space and time to realise what you really want. Phil's just said, sounds like it'll be a positive mood. Pandas sounds great. It's not too far removed from nursing, which is
no,
true.
it's not too far. It's not too far at all. It's just, like I said, it's a bit of a sidestep.
How are you feeling about? I mean, you said there, Rachel, that you're kind of a frequent flyer in and out of hospital now. You've had 4 visits during the COVID pandemic. I guess you could be going back in again. Have you got any thoughts about that? What you would do to yourself?
Yeah, so I kind of following on what you just said. I do a lot of work with my trust as patient co-production. So I wave the flag for involving patients, the importance of involving patients in QI projects at the beginning and not at the end, and having a patient's voice in any quality improvement change is really important to add that perspective. And in the trust, we were doing really well in involving co-production with patients. We had patient voice volunteers, and it was really doing well. Now during COVID, that's all kind of halted in my trust, and even though I've had these admissions myself, which I know, I've wanted to get involved and help a bit more with the co-production side. It might have been good for somebody to ask patients what it was like for them that are regularly in, and what changes and maybe what they can see, and involve that co-production. And I know, even though I've got these admissions coming up, most likely, I like having a purpose. And for me, the purpose is, I used to work in the healthcare. I don't work anymore because of my health. I'm not able to work full time. I run the social media for Academy of Fab, which is incredible, and it's so lovely seeing some of the really good changes and the good innovations that are happening in other trusts. And that really keeps me going. And also being involved in my local trust and trying to get things, patients' voice heard and co-production. I was on a panel and I was interviewing directorates, and I would basically interrogate them about co-production and how would they actually involve patients, not just an FFT form, which I'm not a fan of, but how actually, because hearing a patient's voice in the room is really powerful, and there was some resistance to that, but we were getting there. So I'm hoping for COVID moving forward that isn't stopped, that maybe Zoom can be used and the patient's voice is still involved in co-production. And I'd like to know if anybody out there, are your trusts still doing that? Are they still involving patients in co-production, or is that halted as well?
Yeah, it's interesting the Milton Keynes experience that they've come up with in comparison to yourself, where it's kind of closed down patient involvement. Yeah, we've had
a few. So, Martin, I'm sorry if I say these names wrong. Martin Sadden has said one of the things that I've picked up on throughout is fear of and about all things COVID from all sides, patients, the medical staff, families. Do people think that it's a fear of the unknown as it was back in March, or even now that it's more of a known quantity? Does that fear still persist, and or hasn't the fear increased across the board?
Speaking personally, I think that the fear is there. I think I'm much less obsessive about it than I was before. I think I'm much calmer about addressing it. Although last night I spent an hour and a half watching a dispatches program or something like that on it. So yeah, it's still there. I live in a remote rural area in the Highlands, so I'm not bumping into people all the time, and I suppose the inner hermit in me is quite pleased to be left alone and sort of isolating for a little while. But I can imagine for younger people and for people in urban settings, it could be a lot worse and more worrying. What do you think?
Yeah, I think it can be the fear of the unknown. I know that when I was on that ward just before it was announced of the national lockdown, the fear of the staff was really easy to see. And because I know these staff really well for the last 5 years, I'm in hospital all the time. I know them well. It was hard for them to hide their fear, and some of them were concerned about where they would go. Because a lot of nurses, especially if the ward become a COVID ward, they got distributed elsewhere, and I know they were worried about that. Learning different skills at different teams. So I think that for me, holding the fear consistently is it's kind of gone through its own journey. Like I was fearful at the beginning, and then I kind of went into this bit where I just acceptance, and now I'm aware of what's happening, but it doesn't feel as much fear as it was at the beginning. And maybe because I've done the hospital admissions, but for somebody that has to be admitted during hospital during this time, there will be a lot of fear the first time. Because things have changed, not knowing where to go. I always have a temperature, so I'm always put in the A&E. I was in resus in the COVID bit, and although I was out of it, I coming around and realizing I was in that bit because I had a temperature. Some patients it will be fearful. Dani, what have you got anything on that to add on that?
Yeah, I think for me, because my anxiety was already high and because I was already, struggling with that, I think I really struggled at the beginning before the lockdown and before I shielded, because although I was adamant of going to work and seeing patients and not really bothering at that, just going to the supermarket was really difficult because it was so unknown. I'd be walking around and I'd be physically shaking, or I'd have white knuckles because I was gripping hold of the trolley so hard. And for me that was hard. And then I think because of the compassion we have and why we're doing what we're doing, is what really hit home was going into empty shelves and seeing elderly and vulnerable people looking at these shelves thinking, I don't know where I can go or what I can do next. And and not being able to fight the way through crowds to get to things because of the way things went, and that was fearful for them then. So it wasn't just my own fear, I'd start to fear for them as well and what was going to happen to them. So yeah, and I think it took a while for me to understand and rationalize things, and eventually it took the point where my husband did all the shopping anyway because I just physically couldn't get out and do it. And then when I started shielding, obviously I wasn't able to go out then. So yeah, I think it's an unknown. It's definitely the unknown, and I think that's going to carry on for quite some time for me personally, of not quite knowing what's going on and how that's going to affect people and things like that.
There was a question from Jennifer. It says, I am a resuscitation officer and have been working hard in a sort of background to all the pandemic. A lot of the terms have been out about the frontline staff and the amazing jobs they are doing in caring for patients. But it's also important to recognise the many, many roles we have within the professions of nursing, working in the background, trying to help our colleagues. Yeah, Jennifer, I completely agree. You know, I wrote a blog post a few years ago about the unsung heroes in the NHS. And you're right, there's a lot of talk around the ones that are on the front line and what an amazing job they are doing. But some of the other staff and how they have adapted their roles to help the frontline staff and how the work that they are doing. Brian, you've got anything to add? Or Dani?
Yeah, I think there were a lot of people who obviously had to change their roles and go into new things. I had a colleague down in London who's a health visitor, paediatric trained nurse, who had to go into one of the Nightingale hospitals and work on an adult ward, and with very little transition, I suppose, because it was quite immediate. And I think it's really difficult for people who have come from so many different backgrounds and then expected to do a role that's very, completely different. And the support and that needs to be given to those people, and like I said, with mental health, is going to be a long time coming. Is the support that's going to be needed over the next few months to maybe year, to help those people who've had to go from one job to another. And they've all done an absolutely amazing job, and they've all cracked on and done what they've needed to do. But actually, it's very much out of their comfort zone. Then they're putting into the line of fire of how busy it was and how things were. And I suppose it was new for everybody as well. So nobody really knew how it was going to turn out because nobody had done it before. So yeah, I think support and understanding and the frontline staff is definitely going to be something that's going to be needed. And when people do start coming back to their original roles, if some of them may not, then it's looking at them professions and how they then work with the colleagues and how they move forward with that.
I think Jennifer was also talking about, the staff that weren't frontline and what work they're doing, and that they might not get talked about as much as the frontline staff, but they're doing amazing things behind the scenes as well.
Do you know, they've all, I think they've had to, the support that they've given and the way that they were very much in the background, and I do think they need to be talked about. And I think for you as well, I think maybe getting a share, Jennifer, of all the things you have done in the background and getting it on FabChange Day, that's what we're about, and that's what we're actively trying to promote. So Jennifer, you've done an amazing job in the background, and it is a shame because you don't hear about the admin staff and the background colleagues and a lot of the things that they've had to change in the way that they've had to change their roles. So yeah, I think it's hard, but thank you because you have been doing it. So talk about it, share it. Thanks for asking that question and bring it to us, and let's try and get more people talking about all the things that they have done in the background that isn't necessarily talked about, because that is what this platform's about.
Great, and I will put the Academy of Fab website in. You just have a profile, then submit your changes. Christina has put a comment saying it's been challenging to continue patient involvement and co-production. We have used email communication and Microsoft Forms for collecting feedback and shaping a service according to the feedback, but it's been more of a one-way communication. I'd be really interested to hear how others have managed to continue patient engagement. Well, Christina, if you hold on to our presentation at 2, it's from Royal Free Hospital, and they're talking about therapy patient partners, and it'd be really fantastic how they've actually involved them in lots of changes that are happening. They're involving them now during the COVID, so you might find that really interesting at 2 o'clock. Daniel, Brian, you got anything you want to add to that?
No, not really. I think hopefully this has been a useful conversation. It's really good of the Academy of Fab to put patients in at the centre of this. Very often we're pinned at the back like the tail of the donkey, but today we're in room one, and I think it's great that we can open up and have these frank discussions about what are very difficult circumstances, I think. So, no, I think this has been useful, I hope, to other people.
And Christina, I think for the chat, it has been challenging to get that communication through for patients and understanding, and that's one of the great things about the FabChange, and the fact, like what Brian's just said, we are here and we are able to talk about our experiences and get that. But I think social media for me has been a really big way of connecting with service users. And we have been doing a lot of virtual meetups and coffees and a natter. So from people from their own home, putting an Eventbrite on and getting service users to come forward and chat about their experiences as well. And then I've collated all that in the notes and emailed the trusts with that. So I'm not, so as an MVP, I'm not actually physically part of the trust, but I am getting them service users. And with a lot of groups starting to run as well, so support groups are able to run under the new guidelines, and the baby massages and the children's centres and things are all starting to reopen and be used, then actually contacting a leader of one of them is really good. And actually speaking to the district nurses and the ward staff and other people who do have direct contact, and getting the feedback forms and asking them to have them conversations, and then feeding back to a person who then can collate it as an abstract of what they've been saying.
Tom Lake has also put a comment in saying, I've never thought of our DGH patient conference as a serious activity. As a governor at my mental health and community trust, I see some initiatives in co-production, but this is by exceptional commitment by individual clinicians. Of our local primary care practices, most PPGs are moribund, but there are some often in more prosperous parts where the combined commitment of clinicians and patients has created thriving collaboration.
Yeah, and again, it usually is down to, unfortunately, one person to have that commitment and that dedication to do that. And I think it's just for all of us to take on board that, patients have got a voice, and there are many ways in we can reach us. And in this digital era, there are so many different, forums that you can use to get that, and maybe hoping that it's everybody's business and everybody's job to collate that feedback, and maybe just one person who can then put it all together as an abstract.
I'd just like to reply to that as well. In my trust, I'm a patient partner to the director at surgery, and I know that in having that the last 2 years when that started, me being able to speak to this director was able to get him on side and understand why co-production was important. He openly admitted he was doing an IBEVN program, and he got told he needed a patient partner, and he thought, what can I teach him? And I thought he was just an overpaid pen pusher. What could he teach me? But when we actually met each other, we learned a lot from each other, and he was able to then see the importance of co-production and having patients in the room. And then because he was on board, he was then able to kind of go against the tides really and get co-production more. So sometimes it's about having, like you say, finding somebody who is passionate around patients and can see the importance and the positive things that it has with them in the room with co-production.
I think probably I'm aware of the time. And are there any more questions from the group?
Yeah, there's Jennifer's just put, the feeling I have now is colleagues are weary. Post-battle fatigue occurred in our ramp-up prep back in March. Now we feel we're going into it all again. But I think we are in a better position now than we were in, and applause all the work with colleagues and patients to enable this progress.
I agree with that. I think I'd like to thank you all for coming along and listen to us chat today about our own experiences. Hang on, there's another one come in from Christina.
Out of interest, how did you all get involved in sharing your perspectives today? How were you identified and approached? Christina, I'll answer that. So the Academy of Fab NHS staff have created FabChange Day and have created this programme. They actually had in the steering committee to organise this, patients were involved. So Brian was in the room, I was, and Dani. I'm also the social media for Academy of Fab. So there are patient involvement in the academy, which I think is great, not only for the clinicians and healthcare professionals, but also having the patients. So we were then asked, I was approached by Terry to kind of do this, and Brian to chair the session, and also Dani to chair the session. So that's how we were really identified through I think Brian and I having our profile and talking about, for me, I've got Rocking Two Stomas is my profile name, my social media. So I talked about patient involvement and things on there, and I was identified then from social media by Terry and work that I've been doing with Coloplast, and she asked me to get involved. So it kind of happened naturally, really, of just kind of being out there and talking about my patient journey, but also other patients and what it's like with co-production, and Brian's similar as well.
Yeah, you know more about this than I do, Rachel, but how would people who don't know about the Academy of Fab get involved and get in touch? Would it be through following the website, things like that?
Yeah, so the website is Academy of Fab NHS stuff. If you type that in, it will come up. If you want to submit any innovations that have occurred, you just register your name and then submit. Also, the Twitter is running a lot, and Twitter is continually going. So if you've got any questions, you can message on Twitter. But we will, whatever is submitted onto the website will then be shared through the social media. So other trusts and organisations can see what's happening. I can then pinch with pride, and yeah, and that's how you would do that.
Well, again, I think we'll wind it up now. I think hopefully this has been useful, and again, thanks very much, Rachel, and if you pass on to Terry for putting patients in at the centre of this discussion. Thank you all very much indeed.
Thank you, Dani, as well.
Thank you.